is a virtual meeting that is only accessible remotely. Please join the meeting from your computer, tablet, or smartphone. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law and the Governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place, this public meeting of the City of Lawrence's local Board of Health is being conducted via remote participation. Members of the public attending this meeting will be allowed to make comments if they wish to do so during the portion of the meeting designated for public comments. Members of the public may address the board via phone, video, or typing a message to members of the board or city staff. Until that time, all members of the public must remain silent and mute their device until not acknowledged by the board. First, roll call. I, Dr. Joel Gorn, and Stephen Hill, are you present?
Present. Stephen Gale, present.
Great. Do I have a motion on the floor to accept the minutes from our meeting dated December 16, 2020?
Can I have a motion to accept the minutes of December? What was the date again? 16?
16.
Yes, of 2020.
Okay, all in favor? Aye. On to public comments and public participation. Is there any members of the public that would like to participate in our public comment section? Very good. Communications and report from the Director Agent to the Board of Health, Mike Armano, Honorary Doctor. So I'd like us to focus this meeting on specifically the COVID-19 update, an update regarding our now second mass vaccination site that recently opened in the city of Lawrence at the Arlington School, and the current phase of business reopening that we're in for the city of Lawrence to educate our businesses in regards to what they can open and what the current rules are. Mike Armano, take it away.
Thank you, Dr. Glenn. Mike Armano, Director of Inspectional Services. So we're at 18,206 cases of COVID-19 in Lawrence and 236 deaths. It's still prevalent in the city of Lawrence, but things are getting better. We've had 4 deaths in March. Our percent positivity rate has dropped to 4.98, but it's still number 1 in the, or number 2, I believe, in the Commonwealth for big cities. Our vaccination outreach is the story, the recent big story. So far, as you know, our Lawrence General Hospital site at the South Lawrence East has expanded. We've gone, we're now operating from around 7 in the morning till 7 at night as of this week, doing over 1,000 vaccinations a day. We've opened our second municipal clinic, which is at the Arlington School on the north side of the city. Last week was our first week of opening that clinic, and we vaccinated 600 Lawrence residents or Lawrence workers. And we are, right now, it looks like we have a commitment from the Commonwealth to get at least 600 vaccinations each week. So it's supply is still the big question. It's been a struggle to get supply. We're very proud of what we've accomplished in the city. In addition to the LGH site and the municipal site at the Arlington School, our Greater Lawrence Family Health Clinic, they're also working very hard. We're in weekly conversations with them. They're doing about 900 vaccinations per day, and that includes different people in the Merrimack Valley. They have a location here on Essex Street in Lawrence, as well as locations in Methuen and Haverhill, which actually sees a few Lawrence residents as well. So we're currently in our vaccination phase. We're in phase 2. We've reached into the teachers and daycare workers. We're 65 years old and older. We're still in long-term care, of course, some first responders, healthcare workers. We're still continuing to vaccinate those populations as well. On a business opening front, we're reaching into our last phase, just in the beginning of it. So the Commonwealth is preparing to reopen as the numbers drop a little bit. We're still very cautious, especially here in the city of Lawrence. We still have many social determinants that do not make avoiding COVID-19 easy. So we're asking businesses to open, continue to use caution, continue to wash your hands, sanitize, wear masks. All these things are critical, even with the vaccinations increasing on a daily basis. One of the things we did, as you know, Dr. Gorn, I believe it's under new business tonight, but we have an executive order that that needs to be ratified. That executive order allows our restaurants and food service industry to open till as late as 1 a.m. for dining. And that's Executive Order 2021-01, February 23rd, 2021. So I'll be asking this evening, if you want to take it now, feel free, but I'll be asking for a motion to ratify that order.
Okay, we could do that right now. Do I have a motion on the floor, Stephen, to accept Executive Order 2021, allowing businesses and restaurants to remain open for in-person dining until 1 a.m.?
Can I second the motion? Or do I have to present it?
I think you need to make the motion.
Okay. Can I make a motion to accept the executive order, the number
2021.
2021, to allow businesses to be open till 1 p.m., 1 a.m. Am I correct?
Businesses and restaurants.
Businesses and restaurants to be open till 1 a.m. So once again, I would like to make a motion to. I'm having a poor connection. Can you hear me? Can everybody hear me?
We
I'm sorry.
can hear you. Yes.
Okay. So I would like to make a motion to accept. I would like to make a motion for the amendment of 2020 to allow businesses and restaurants to be open till 1 a.m. Am I correct?
Mike, is that sufficient?
Yeah, I'll just repeat it if you could through what I read here. The executive order is to ratify. I'm sorry, this would be a motion to ratify the executive order 2021-01 that was issued on February 23rd, 2021 by the mayor and this Board of Health through me, your director. And it's an executive order relinquishing some restrictions on the hours of operation for restaurants and food service.
Okay, we don't need to restate that, but we'll take a vote. All in favor?
Aye.
Aye.
Yes.
Okay, the ayes carry it, and the executive order has been ratified.
Thank you, Dr. Gorn. And the last thing I have for you is just for those in the public who are interested in the vaccination numbers, they're now being published on mass.gov. I believe it's every Thursday. So Lawrence has vaccinated 11,151 persons as of last week. Some of our abutting neighbors, Haverhill has about 12,000, Methuen 11,000, Andover 8,000, North Andover 7,000. We're still working very hard to get our population vaccinated, and as supply increases, I think the public would be happy to know, if you haven't seen it already, we've stood up quite the operation at the Arlington School, and it has capacity to push 1,000 vaccinations per day once we have that supply come in. And that's being fueled by our nurses, our pharmacists that we hired. Our Lawrence Fire Department has been part of this. Our Lawrence Public School nurses have done a tremendous job supporting the first site at the South Lawrence East, and also helping us with the second site as well. So I could go on and on about the involvement in the city. There's several departments, several people, but a lot of municipal workers working hard to make sure that we have this site up and ready as the supply increases. And that's all I have for you, Dr. Gorn.
That brings me to so given that our main goal is to immunize as many people as we can in the hardest hit area, which is Lawrence, are the vaccine appointments at the Arlington School predominantly reserved for Lawrence residents?
Yes, that is affirmative. So the two types of vaccine clinics we have is the municipal clinic, which is our Arlington School, and the Lawrence General Hospital clinic at the South Lawrence East is the regional clinic, which is open to the Merrimack Valley. And I should note that the easiest way to schedule an appointment or get on that list is calling our call center. That phone number is 978-620-3330. Again, 978-620-3330. And you can also pre-register for a vaccine by visiting the cityoflawrence.com /VAC Lawrence. That's VAC Lawrence. Again, cityoflawrence.com /VAC Lawrence to pre-register for a vaccine. Our call takers will help you register, and they'll also reach out to you as soon as the supply becomes available.
Can you state for the public the hours of operation of the call center and the?
Thank you. Yes. So the call center is open currently from 3 p.m. to 7 p.m. That's 4 hours a day. And we are looking to expand this as the priority levels open up and we can vaccinate more people. But currently 3 p.m. to 7 p.m. The vaccination clinic, again, at the South Lawrence East is, I believe, 7:45 a.m. is the first appointment and closes at 7 p.m. And the Arlington School is going to be changing different hours depending on supply. So typically right now it will be open Wednesday through Saturday. Again, depending on supply, it may just be open a few hours each day. And there'll be daily emails that go out if you pre-register.
So I think it's an absolutely tremendous accomplishment having set up this municipal clinic, vaccination clinic. I definitely want to thank you, Mike, for being such an integral part of setting up this mass vaccination clinic at the local level. It's no easy task. I also want to send thanks to Martha Velez, who was also instrumental and also involved in setting up this clinic. Is there anyone else, Mike, that we should thank publicly for the time and effort that they put into setting up this site?
Yeah, I appreciate you saying that. And there's so many people, and I feel bad that I will leave some out, but just you yourself, Dr. Gordon, I've had to hunt you down for many forums, and I appreciate you doing that. So the public should know your involvement in this. There's, again, the Lawrence Fire Department, the Lawrence Public School nurses. I can't say enough about those public school nurses and what they did through case tracing, as well as doing the vaccines. They have stood up about 7 pods over at the Lawrence General site at South Lawrence East and helped us transition into this new site. Everybody on this call that you may or may not be familiar with, but for those of you who don't know them, Jackie, our city nurse, our clerks, Lisa Rosario, Michelina DiMartino, Jamie Severino is another one of our lead nurses, was Melda Perez, not on this call, Felix as well, Mike LaFrance, so many people in our office who've done so much work to make this happen. Just about every municipal department has been involved, the police department, DPW, IT. Again, I feel bad listing them because I know I'm going to forget a few, but I keep saying this, but I think the city would be very proud of the municipal workforce and all the time and effort that's been put into this, all because we know that the health inequities are very real in the city of Lawrence. So the current numbers that our Latino population vaccination rate was initially low, and we're doing a lot of great things to get that number increased, but it's very important to the municipal workforce and the community. So there's been great efforts for it. So I appreciate you giving me the time to rattle off some of those names.
That's important. And Jackie, thank you. You've been there from the beginning, front lines and Felix too.
Thank you.
Absolutely, all of you. It's just been tremendous the amount of effort you all have put into fighting this pandemic. All from the purchasing of the vaccine storage, which was costly and involved, to setting up the logistics for the site, to setting up the scheduling logistics, both the phone bank as well as the online scheduler is no easy task. And I'm very impressed. Thank you again, all of you. Let's move to the next item on our agenda, which is old business. I think flu clinics, there's been no flu clinics as of late. Is that correct, Jackie? Our focus has been predominantly on COVID.
That is correct.
Okay. General report from Caesar regarding tobacco control in the city of Lawrence. The floor is yours.
Yes, my report will be a short one. Well, as you know, we have suspended compliance checks where we use kids to check whether retail stores are selling tobacco to minors. We've stopped that because of the pandemic. We waited until the numbers improve and more people are vaccinated, and especially the kids that we use are vaccinated. 3 people in the car at the same time. So even wearing a mask, there's a level of risk involved there. So I just rather have everybody vaccinated before we resume those compliance checks. And that's been pretty much the same across the Commonwealth. Most tobacco control programs are either not doing that or they're doing it in a very limited capacity, basically responding to certain complaints. The presence in the store, we're trying to do that as much as we can. I've been doing rotating inspections. I was out of commission for, as I said earlier, I was out of commission for a couple of weeks with COVID-19 in the second part of the February. But I'm back at the stores, and compliance with the state law has been as expected. There's always some level of confusion. I try to dissipate those by providing explanation on site, but also I follow up with mailings, both in English and Spanish, to make sure that some of the issues that come up more consistently, they are addressed at least in a couple of different ways. One is at the store, and the other is through the mailing. And some people have called when they have questions, but I would prefer to have them called more often, and they haven't done that. Also, because of the new state law, at some point we're going to have to do an update of the local regulations. So I've been compiling some elements that I believe would need to be tweaked to be in compliance with the state law. To give you an example, the state law for most violations establishes that the fines are $1,000 for first offense, $2,000 for second offense, plus suspension for 7 business days, and $5,000 for third and subsequent offenses, and suspension of a tobacco permit for 30 business days. So our local regulations says 100 to 100, 300. So we need to tweak that part. And there are other issues that have come up as part of the enforcement process that I think that, once we tweak them at the local level, I think we're going to have a more robust regulation and more in line with the state law. That's all I had. Are there any questions?
That's good. Stephen, any questions?
Have we heard of when Lawrence will receive the Johnson & Johnson vaccine? Sorry, this was probably directed towards Mike.
No worries. The answer is we don't know right now. The supply was very limited. We may have more information on it closer to April.
Okay, so we ratified the executive order, and let's schedule. I'm going to have to get back to you on scheduling the next Board of Health meeting, but most likely it'll have to be at the end of April, if not the beginning of May. Let's focus on ramping up our capacity at the clinic. And any suggestions for the future agenda of the Board of Health would be much appreciated. But I think we got our hands full, but I'm happy to announce that it is 6:30 in the evening and it's still light out. And that's a great thing. That makes me very happy. And seeing the numbers trend down are also is very exciting. I have patients coming in my office that I haven't seen in a year. And they're coming in and they've received at least 1, if not 2 of their vaccines. It's really changed the game for a lot of people that are very, very much at risk. So it's great to see spring arrive, and I really feel like we see the light at the end of the tunnel. But as Dr. Fauci has said, we can't let our guard down. We have to continue to, exercise common sense and precautions in public as we are dealing with several variants that we don't know enough about. The UK variant, the South African variant, the Brazilian variant. And while we think there may be some protection from these particular vaccines, people that have had COVID once and we thought could not get it again can certainly be susceptible to a variant. So it is our job and our duty to continue to encourage our friends and neighbors and patients and coworkers to get vaccinated. It is essential. The only way we're going to stop this pandemic. So with that, I'd like to ask Stephen to make a motion to conclude this Board of Health meeting today, the 16th of March. Stephen, do you agree?
First and foremost, thank you for all you do. You guys work hard behind the scenes. You guys are fighting the fight, pushing the information out there, getting our elderly and everybody else in Lawrence vaccinated. And I applaud you and thank you very much. And I'd like to make a motion to conclude this meeting of March 16, 2021.
Thank you. All in favor, aye. Have a wonderful evening, everybody, and we'll reconvene soon.
Good night,
Thank you.
everyone.
Bye-bye.
Bye-bye. Thank you.